This is Mountain Scheck-Snyder, and I'm the creator and founder of the Erasure Back Pain program. And today what I'd like to do is to talk to you a little bit about a diagnosis that we often see in the clinic that is referred to as spinal stenosis. Now, spinal stenosis is a condition that basically refers to narrowing of the spine itself, and specifically it is referring to two types of stenosis types of problems. Number one is that the opening through which this nerve here, this yellow structure right here is the nerve, the opening through which that exits begins to narrow, and that process is called stenosis. In addition, and you can't really see this on this particular model, but internally the spinal column itself has an opening through it through which the spinal cord travels this way. If there is encroachment into the cord centrally, in other words, the disc itself or perhaps some bony element or even a ligament type of element starts to encroach into the disc, into the spinal cord this way, that is a condition that is referred to as central stenosis. Now, stenosis, like I said, just refers to narrowing. Typically, we'll see it related to what we refer to as lateral stenosis. In other words, the opening through which the nerve exits begins to narrow. And the result of that, or the reason for that, I should say, is because, number one, the disc height begins to change. Okay? In a previous video, we talked about degenerative disc disease and how the disc height with age normally will begin to shrink. Well, as it begins to shrink, the normal opening that is present at each level here begins to narrow. And as that narrows, there's less room for this nerve root to exit, and that can create some irritation. So the canal, or the bony canal through which the nerve exits, begins to narrow. The nerve starts rubbing up against the bony elements, and then it can create some irritation. The other reason that we'll see some narrowing in this area is that the joints themselves, and these are the facet joints, and you've got a pair at each level here, but these facet joints can become thickened with, say, arthritic type of changes, and as a result of that, that will encroach on the opening at which that nerve exits. That joint is very close to that area. If there are some arthritic changes, some thickening of the joint, then you can get some stenosis at that area. Now, stenosis will present itself typically by symptoms that are associated with pain with prolonged standing. Pain will usually go down into both legs, usually to the level of the knee, and sometimes even all the way down to the feet, usually both sides, like I said. So you'll get pain into the buttocks and down the leg. You will also have pain with prolonged standing, and the pain will be relieved when you go to sit or bend forward. And the reason for that is that as you bend forward, that opening begins to open up. So if you have a narrow opening in this fashion and you bend forward and you get a little bit more opening there, or a little bit more of a diameter of that opening through which the nerve exits, then you're going to have more room for that nerve. It's going to take some of the stress off that area and relieve some of the symptoms. Now, the treatment for stenosis is typically conservative. If there is some very acute nerve irritation, nerve inflammation, then an epidural injection will be effective in reducing some of that. The other thing is that very specific therapeutic exercises can affect this as well. Over time, what happens is that the muscles begin to change in terms of some muscles becoming very tight, some muscles becoming very weak, and those imbalances of weakness and tightness need to be addressed in order to take some of the stress off of the nerve roots themselves, as well as the joints and whatnot. So we have to be in a position to address those, identify the specific muscle imbalances, and then treat them in a specific order. If we can do that effectively, we can basically manage the stenosis problem. Can't change it, can't reverse it, but we can certainly manage it to the point where you don't have to be looking forward to surgery. You can slow the whole process down. I hope the information I provided you today about stenosis has been helpful in your understanding of the condition, and that it might offer you some information that you can use in your pursuit of pain relief. For more information about how my program might be able to help you with your particular situation, just visit me at the link below, and I'll be happy to look into your condition and see if my program makes sense for you. This is Mountain Scheck-Snyder wishing you all good health, and I do hope our paths cross soon.